Glaucoma is a disease characterized by chronic retinal ganglion cell loss, and studies have shown that nearly 25 to 35% of ganglion cell loss would have occurred by the time visual field defects become apparent on automated visual field analysis. So it is now believed that electrophysiological tests may help in evaluation of pre-perimetric glaucoma. There are various electrophysiological tests that have attracted attention: the pattern ERG, the photopic negative response, the S-cone VEP, the multifocal pattern reversal VEP that Dr. Mohammed is talking about. I'll skip the basics. So basically here the stimulus is a checkerboard pattern stimulus. And these are some of the things that we need to understand. The frequency of the checkerboard reversal can be changed. If it is less than 4 reversals per second, the waveform that is obtained is called a transient response. And when the frequency is more than 8 reversals per second, it's called a steady state response. The check size can also be altered. What you see on the top is a 0.8 degree checks, and what you see on the bottom is a 16 degree check. And we have already gone through this. The normal waveforms, P50 and N95 is more important. Now, various studies have demonstrated that the pattern ERG is abnormal in patients with glaucoma. It's mostly the amplitude and not the implicit time, and specifically the N95 component than the P50 component. Now, this study by Back et al., he tried to compare the two check sizes, and they found that in patients with early glaucoma, the pattern ERG amplitudes are abnormal to the smaller checks, but then they are normal to the larger checks. In patients with advanced glaucoma, the pattern ERG is abnormal to both the small as well as the larger checks. And he showed that when compared to normal subjects, patients with glaucoma have a significantly decreased amplitude, and this effect is more glaring with the smaller checks than with the larger checks. So the ratio, the correlation between the pattern ERG amplitude, the 0.8 and the 16 degree check is called the pattern ERG ratio. Now, pattern ERG ratio is now believed to be a new paradigm in the evaluation of glaucoma. Porciati et al. Had shown that there is a high degree of correlation between these two, and it tends to follow a straight line. So the ratio is around 1 in a normal patient. You can see this is the 5% confidence limit, the upper line, and this is the 95% confidence limit. So in a patient with glaucoma, this correlation is decoupled, and a patient with glaucoma would tend to follow this hypothetical path as shown there. Similar to the pattern ERG ratio is something called a pergola paradigm, where instead of the patterns, these investigators used gratings, and they used surface electrodes instead of the connected electrodes. The results were almost similar. So basically, this large prospective study is an 8-year prospective study on patients with ocular hypertensives. And this study found that pattern ERG is an early risk indicator to detect converters. So this study showed that the pattern ERG ratio was highly sensitive and compared to the 0.8 degree check amplitude or 16 degree amplitude in detecting converters. So we all know that not all patients with ocular hypertension go on to become over glaucoma. This test can help us to detect these converters. Again, Ventura et al. Had shown that pattern ERG loss may be reversible with treatment, and this is a new concept. We are aware of ganglion cell loss, but here these authors introduce a concept of dysfunctional retinal ganglion cells. They say that with treatment, some of these ganglion cells may regain function. This is what they showed, and this effect is more glaring with patients with early glaucomatous field defect. Again, not only the size of the stimulus, the frequency of stimulus also matters. These investigators showed that a steady state response that is obtained with a higher frequency stimulation is better in picking up glaucomatous eyes than the standard transient state stimulus. Again, even the pattern reversal time with a ramp kind of stimulation, as shown here, is better than the traditional step stimulation in picking up from early glaucomatous eyes. Now, the question that comes to our mind is, does pattern ERG, which basically assesses the central portion of the retina, does it reflect a peripheral field disease like glaucoma? This is the next question that comes to our mind. If you look at this chart here, this Back et al. Had tried to do a correlation. He tried to compare the amplitude with the mean field effect. And you see this line here, beyond this is abnormal field, and this line here below this is the abnormal pattern ERG. As is obvious, when the field effect is abnormal, you have an abnormally low pattern ERG amplitude. But what these investigators also showed is that you see this group here, in spite of having a normal field, many of these patients had an abnormal pattern ERG, and so pattern ERG may reflect a pan-retinal ganglion cell damage and not just a posterior pole disease. So it's appealing that having having a multifocal pattern ERG, we can detect a pan-retinal ganglion cell damage. But then investigators have found that there's no correlation between the topographical field effect and the findings that you get on the multifocal pattern ERG. Just to rush through, we did a study. We tried to look at the normal eyes compared with early glaucomatous eyes and advanced glaucomatous eyes. We found that the mean values of N95 and P50 were significantly less in both the early and advanced glaucomatous eyes. You see here that this is a comparison of the two amplitudes. We found that the amplitude was significantly less in early, and the difference between the two pattern sizes was glaring with in advanced glaucomatous patients. Pattern ERG ratio is abnormal in all the patients with advanced glaucoma and majority of the patients with early glaucoma. And this is one such example. So this is something that we may face in our clinical practice. This patient had normal intraocular pressures, he had a normal, not a very bad looking disc, and here you see an OCT picking up a nerve fiber layer defect. The fields are grossly normal, but the pattern ERG in this patient showed an abnormal pattern ERG ratio. You can see the ratios. The machine does a calculation itself. You can see the ratios there. It's less than 1. So this is an example of a pre-perimetric glaucoma. Now, do we treat them? I leave it to the glaucoma specialist, but then pattern ERG may help us in detecting these pre-perimetric cases. This is a very obvious patient with an advanced field defect, and as expected, the pattern ERG is abnormal in that eye, whereas you see the ratios there, and it is normal in the other eye. Their studies have also compared pattern ERG with SAP and FDT, and they found there is a fair degree of agreement between these tests, with the FDT being more sensitive than the pattern ERG. But the main pitfall is, this is something that we need to remember, many of our patients may have cataract, may have other refractive errors which are uncorrected. These can affect our 0.8 degree checks. This has to be kept in mind when you calculate these ratios, because otherwise the ratios may become abnormal and we may end up making a wrong diagnosis. So investigators have recommended that only the visual acuity is better than 0.8 should we employ these tests. To conclude, pattern ERG is a wonderful tool in evaluation of early glaucoma. It's useful in detection of pre-perimetric glaucoma, useful in identifying ocular hypertensive converters. It correlates with other psychophysical tests, and it demonstrates progression or reversibility of ganglion cell dysfunction during follow-up. Thank you.